Welcome back, and thanks for coming back. Let's wrap this up. So we talked about these nursing implications about not aspirating the subcutaneous injection or massaging the injection site for heparin. Some other things that we need to review are that IV doses can be either given bolus or by infusion. Again, I always recommend with IV heparin that we have it double checked, check your math. Anticoagulant effects are usually seen immediately, and then laboratory values are done daily to monitor the coagulation effects. That's through our PTT. Protamine sulfate needs to be on hand to be given as an antidote in the case of excessive anticoagulation. And so most of the time, if you're in a unit where you're giving IV heparin, either by bolus or IV, that is going to be located in your crash cart or some other location where it's really very readily accessible. With our low molecular weight heparins, I think I got my M and W back there backwards. Your nursing implications, it's given subcutaneously in the abdomen. You want to rotate the injection sites. Again, protamine sulfate is given as an antidote if you have an excessive anticoagulation state. Warfarin or Coumadin can be started while the patient is still on the heparin until the PT-INR levels indicate adequate anticoagulation. And the full therapeutic effect of Coumadin takes several days, which is why we don't stop the heparin before we start the warfarin or Coumadin. We'll monitor that PT-INR. Typically, it's just INR now regularly. We want to keep the follow-up appointments and make sure that the patient knows that those are really important. The antidote to that is vitamin K. With Coumadin, many herbal products interact and have the potential for interacting with it. So increased bleeding can occur with capsaicin pepper, garlic, ginger, ginkgo biloba, St. John's wort, and feverfew. Those actually can increase bleeding outside of the use of Coumadin, but then we have, when the patient's taking Coumadin, we have an additive effect. So important that they know not to take those supplements because they'll be basically doing the same thing in terms of anticoagulating. The other implication is that we want to make sure that we've reviewed their medications to make sure that they're not taking something that's already an anticoagulant. Patient education, let me back up here for a second. Patient education with warfarin, Coumadin also includes foods, and so that's something that you'll want to be sure and look for in your textbook or in your resources. Foods that interact or that have a high level of vitamin K can cause an alteration in the INR and of the effectiveness of Coumadin, the medication itself. Patient education needs to always include the importance of regular laboratory testing. It's very important they understand signs of abnormal bleeding, measures to prevent bruising, bleeding, or tissue injury. For example, things like using only an electric razor, not a safety razor. That's an important point. We don't want them to accidentally cut themselves. They'll have a bleed that doesn't stop as well as it should. Sharp objects, things like that. As well as considering seatbelt. You know, if you have a person who has an anticoagulant on board and they're in an accident, they need to have some way that ambulance and other first responders know that they take warfarin or Coumadin, because internal bleeding is something that they would look for more immediately. So they should have a medical alert bracelet if they're on any type of anticoagulant. The same thing will be necessary if they have a history of taking any of the clot buster medications, the fibrinolytics. They are to avoid those foods that are high in vitamin K and consult the physician before they take any other drugs. And that includes over-the-counters. Remember, our NSAIDs and aspirin also have anticoagulation properties. So really important patient education piece there. The antiplatelets, The concerns and the teaching tips are basically the same as they are for the anticoagulants in terms of bleeding, preventing injury, monitoring for the abnormal bleeding. Drug-drug interactions, we wouldn't want them to be engaged in taking an anticoagulant medication or an anticoagulant herbal or over-the-counter drug, and then have this antiplatelet on board as well. So important pieces for them to consider as you're doing your patient education. And then last but certainly not least, following the strict manufacturer's guidelines for the preparation and administration of these medications with our thrombolytics, as well as monitoring the IV sites for bleeding, redness, pain, monitoring for bleeding, both internal and external. Signs of internal bleeding can include decreased blood pressure. Restlessness is often one of the first signs that we will see when we have internal bleeding. And increased pulse, they'll become tachycardic. So, as always, feel free to post questions up in the discussion forum under questions for the instructor, or email, call, or text me. Hope you have a great day, and we'll talk to you soon. Stay well.